I'm showing that it is 10 a.m. on August 20th, and we will go ahead and call the commission meeting to order. Would ask Commissioner Blackwood to please read the notice of meeting statement.
A notice announcing the date, time, and place of August 20th, 2020. Commission meeting was distributed August 18th, 2020 to appropriate media and other groups or individuals who have requested notification. The announcement and agenda were posted at the Department of Disabilities and Special Needs Central Office and on the website.
Their mobility assistance section of that.
The Americans with Disability Act says the public has been notified that accommodations such as interpreters, mobility assistance, or other assistance will be provided to individuals with disabilities and special needs if requested in advance.
Thank you. We'd like to welcome everybody who's listening in. Hopefully you can hear us. We are a little bit distant to maintain our protocols. We'd like to welcome those in conference room 180 as well. I can see a couple people there. Thank you for joining us and also working with us so that we can maintain proper social distancing. The next item to take up is the adoption of the agenda as proposed. I'm not aware of any changes that need to be made. Does anyone else have any proposed changes or amendments to the agenda at this time?
No.
Seeing none, would entertain a motion to approve the agenda.
So moved.
Second.
All in favor, please indicate by saying aye.
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 That being said, the agenda approves. Would call upon Commissioner Rawlinson for the invocation today.
Dear Heavenly Father, we do ask that you be with us today as we do the work of your hands. And Lord, we ask you to guide us and to keep us all safe as we be here together. Lord, we ask you to watch over us and to watch over those we serve and let the work we do be pleasing in your sight. We ask this in your name and pray. Amen.
Amen. Thank you. Next item on the agenda is the approval of the minutes from the July 16th commission meeting. Does anybody have any changes, corrections, or additions to the minutes as proposed? Seeing none, would entertain a motion to approve the minutes as proposed.
So moved.
We have a second.
Second.
That's
All in
a,
favor? All in
sorry.
favor?
that was a first by Barry and a second by Dave Thomas.
Thank you. All in favor, please indicate by saying aye.
Aye.
Any opposed? Hearing none, the minutes are approved. Next item is commissioner update. Does any commissioner have anything they wish to address at this time?
Mr. Chairman,
Yes.
the PD providers did meet yesterday, and we were very fortunate. It was Commissioner Miller and I had the opportunity to meet with them, had a wonderful conversation with them, and learned a whole lot about what their needs are, and we hope to be able to serve them better since meeting with them. And we hope to meet with them every month from here forward.
Great.
Can I ask, Mr. Chairman, can I
Yes.
ask a quick question of that?
Sure.
I'm real impressed that you all were able to meet with them. When I was appointed, Mary Poole and I had talked about, making sure that I was put properly to work, learning as much as I could learn. And of course, COVID sort of upset the apple cart a lot for scheduling all that. But I would really like if they do that again, making sure that all the commissioners know. Maybe it went out. I didn't see it because
It was just the region. Because of the region they're in, it was that PD region.
Okay.
Yeah.
I got it. But that would be awfully good for, well, if any of the other commissioners, I just feel like I need to know all the moving parts. It's a complex organization, very difficult to follow. It's not as straightforward as you might think, and I think I realized that many years ago when I first kind of looked at when I was in the legislature and looked at it, I thought that's a complex group they've got over there. Mm-hmm. But to do a proper job as commissioner, it would be helpful for me to be able to participate like that, Mary. So thank you very much for you all for meeting with them. And they were kind of giving me a briefing there before we got started about some of the complex financial issues that we're facing. So I'll just end it with that, Mr. Chairman. What I'm hoping is that all of us, all commissioners can be offered the opportunity to segue into such meetings. Of course, Barry's an old expert. I mean,
I don't know that.
he didn't need that, but I need it.
Well, no.
Guys, I do want to tell you there's an opportunity tomorrow if you like, and Commissioner Blackwell has done this before. Tomorrow,
Blackwood.
Zoom meeting with the coalition group. They meet like on the Friday after our,
That'd be wonderful.
you know, and they have invited before, I might be overstepping, but, they don't, I would think that you can take my spot. Because we meet with them, we get an invitation to meet with them. and-
Doing a Zoom, I presume?
Yes, it's all, you know, I think they're starting to do some in-person meeting, but mostly everybody's meeting Zoom. So if you would like, I'd be happy to send the link to whoever wants to be that. That's a statewide group. And the human service provider group, I'm sure they wouldn't mind extending the same invitation, but they meet on the first Tuesday of the month. And the coalition meets on the third Friday of the month.
Maybe if Sandra could.
Yeah, no, I'll send it. I just got my invitation, so I'll be happy to forward it to you.
Thank you so much. I'll try. I'll try to get up on Zoom.
It's
So that-
actually, Zoom is pretty, I think it's more user-friendly than Skype.
It is.
So I think that, yeah. Well, let's put it this way, Commissioner Tom, my mother uses Zoom to talk to us.
Oh, please. I hate to tell you.
She can do it, Lord have mercy, everybody.
Yeah, and just to sort of segue on that, you know, one of the first things that I did when I joined the commission was got a list of all the big providers, all the county providers and private providers outside that were in my district. And I just set up a time to go visit them all.
That's great.
I spent a few hours with each one, whether it was meeting with the executive director, or
Yeah.
whether it was their board, or whatever the case may be. And that was great, because that way, most of them had never met a commissioner, was one thing that I was doing. And so, you know, I probably need to make that circuit again, because it's been a few years. But it was just, you know, once a month I would take a trip and go see something.
Chairman, that's exactly what I was gonna do before COVID hit.
Yeah.
I was gonna be real active about doing that, so I feel sort of guilty. I don't know what else I could have done, I mean, in what we've all gone through the last 5
It's the kibosh on
Yeah.
everything
Yeah.
that you really want to do.
Yeah.
Yeah, but I found that very rewarding, and I know Commissioner Blackwell's done the same thing, so.
And Mr. Chairman, this is Ed Miller. We did have Pat, our auditor, on the line.
Oh, that's right.
as well.
Our
Deputy
associate-
Director.
Deputy director,
Yeah.
he was on the line too.
Fabulous.
It was really good.
Question.
It was a good meeting.
Question, y'all have to be mindful of how many attendees so that you don't have a meeting?
That's right.
Correct.
Yeah.
Can't all-
Just want to make sure y'all don't
Yeah. you can-
aggregate.
Good point.
You all can't congregate.
Three.
This is
Three
very,
commissioners.
that's a very interesting question. I mean, legally, Gary, because let's suppose we were all Democrats in here, and we participated in the Democratic convention that is going on right now, and we're all, because they're all online. Is that a meeting? I don't think so. I think.
Not dealing with business.
Yeah, I would think there would have to be some level of business.
Business
I mean, we're there for the business of a separate committee, right? The Democratic National Committee or whatever.
That's a really good bar question.
Yeah, it
Really,
is.
I like that question.
Yeah.
I think if you're diluted sufficiently, you're probably exempted from the requirement.
If you're meeting with our providers though, I think that's pretty much business specific.
Okay.
But we can pose that to our lawyer.
I like that.
Yeah.
I like it. I like it. Good question. Well, excuse me for interrupting the flow of business, but I wanted to just get that in. Thank you all very much.
There is an ordinance, that we do need to look at, because if it's over, we have, what, 7 commissioners? I think.
Yes.
7 seats, 6.
7 seats.
Yeah.
Okay, and so that if you have a majority, then they consider that as a meeting.
That's right. So if as long as it's less than 3 of us talking,
That'd be
one
fine.
place, it's fine. 3 or less.
3 or less.
Unless 3 or less.
It's more than 50% or 50% or more?
When we dealt with this before, you had to at least be able to get to a quorum for it to be a meeting.
Right.
So it had to be 4.
That's right.
Okay.
That was what we were told before.
Yes.
That's
Gotcha.
not a meeting.
Okay.
That's what.
Unless
the
you have a
information
quorum.
actually-
Okay.
That's the Home Rule Act of 1975, when that started.
Anyway,
Long agenda.
Okay.
it says that on the Freedom of Information Act.
All right, ready to move on?
Yep.
Okay, so the next item on the agenda is public input. The good news is that it appears like our system for putting that in place has yielded some success because we do have some public input. First, we recognize Elizabeth Kraus. I believe she's already on the phone right now. Elizabeth, can you hear us?
I certainly can.
All right, we recognize you. Thank you for taking the time to make yourself available for us for this.
No, we appreciate you opening up the opportunity again. It's hard in virtual land these days. So, good morning, everyone. I'm the Executive Director of Georgetown County Board of Disabilities and Special Needs. We're a very small agency that's been around since the 50s under many different names, and we have about 100 FTEs, so we're pretty small. Georgetown County itself is a rather small county with about 60,000 full-time residents, of which 30% are retirees. So anyway, our agency provides day supports, employment supports, residential services, early intervention, case management, and a very successful therapeutic riding program that operates year-round. And thank you, Chris, and your team for the summer monies this year. We've been able to provide therapeutic riding all summer for kids with disabilities. So we would like to tell you this morning a little bit about what we've experienced since COVID hit. I know you guys have experienced it. We certainly had to deal with it among staff and consumers, just as others have. Our goal since the beginning has been to reduce and prevent the spread. So early on, I reached out to your staff, Andrew Theron, and he was able to help me work through a process to ensure that we could control airborne infections as much as possible. And I can't thank him enough for his guidance and his responsiveness. We've been able to retrofit all of our facilities with bipolar ionization upon his recommendation. Every single facility is covered with that. With regard to illness response, as a community provider, we don't have doctors available to us 24/7. So our go-to, unfortunately, after hours and on the weekends was the hospital emergency room, even for minor things like a UTI or a minor fall. Every time we had to visit the ER or a doctor's office during this COVID crisis, it risked exposure to COVID for our very vulnerable population as well as the staff who accompanied them. So we began with our board of directors' encouragement in May, exploring options to avoid unnecessary exposure while still providing quality health care. We settled on an emergency room doctor company that specializes in the IDD population. They are all certified ER doctors and currently work in emergency rooms in other states. The barriers for us at first were the costs, and of course the cost of telehealth technology is certainly high. So I reached out to the Telehealth Alliance of South Carolina upon advice from Blue Cross Blue Shield of South Carolina. The Alliance was very responsive, and they actually agreed to fund all of our Bluetooth virtual equipment, and every station has set up in each house and day programs since they funded us. They provided high-quality care through Bluetooth stethoscopes, virtual visits, through their smart pads, oxygen assessments. They do assessments for any health crisis 24/7 and as many times a day as necessary. I get reports every time a visit occurs with one of the doctors, and this company has provided a true wraparound response to our family care. During COVID, they've been invaluable in coaching our staff regarding COVID protocols and doing telehealth visits with our consumers and families if needed. If they determine a true hospital trip to the emergency room is necessary, they call ahead and they give the hospital details about the person and smooth the way for us and the staff and avoid unnecessary testing and expenses. The true test of their benefit has come from the very positive feedback we've gotten from our staff. We've been able to do virtual admission physicals, assess falls and injuries, avoid unnecessary office visits, and e-prescribe even. This saves staff time, nurses time. The doctors are quite familiar with TheraP and enter their detailed notes into our patient records. There's an additional cost for this service, of course, it's not free, but we're covering this expense through our Special CARES Act allocation. Finally, when we avoid hospitalizations, it also avoids unnecessary Medicaid or Medicare expenses, which I believe some of these Medicaid costs actually get costed back to you, DDSN. So perhaps we're saving your agency money and in turn the taxpayers. We are mission focused to deliver the best health care possible during this time. And unfortunately, when words like punish providers are shared by commission members, it makes me think that there's a lack of understanding about what we do here on a daily basis. Our staff are essential healthcare workers, and we're trying to keep the frontline people employed and the vulnerable adults we serve as safe and healthy as possible. There's still barriers to overcome, COVID testing is not up to speed, and we just now got access to a rapid test last week, but for some months we were experiencing 12-day delays in testing, which is not easy to manage. Recently, the PPE subject came up with the FEMA director saying that there was still a stock of PPE at the state level, but that's simply not true. So we're paying higher costs for PPE, and I know you're aware of this. I believe it is our role to make sure that our people are not forgotten, people with disabilities, and that hurricane season is upon us, and the overtime and the complications with COVID that creates is another barrier for all of us. Finally, I just can't say enough about our dedicated workforce in Georgetown. We've only had 2 positive cases among our consumers, and everybody is negative at this point. These guys are as much on the front line as any other profession, and sometimes they're forgotten with not being paid livable wages. We're fortunate we provide them with health care and retirement, but that's not true of all providers. The direct care work today has become more complicated, more dangerous, and we just need to show that we value their work, and providers and commission can work together to value and support the community workforce. Thank you so much for your time, for listening to me, and I appreciate all that you do. Thank you.
Does anybody have any questions for Elizabeth? Elizabeth, thank you very much for taking the time. That was excellent information. We appreciate you sharing that with us.
Thank you so much. Bye-bye.
And next we'll be having Jason Tavener join us as we get him called in.
Hello, it's Jason.
Hey, Jason, this is Chris Clark, Commission's in the room, and we're ready to have your public input.
Okay, I must be a little behind here.
You ready?
Yeah.
Let me turn off the speaker. Yeah, I'm ready.
Yeah, Jason, this is Gary Lamella. How are you doing this morning?
Good, Gary. Thanks for this opportunity.
Absolutely. Thank you for taking the time to go ahead and contact us about having public input. I would recognize you at this time.
Okay, thanks. Good morning. Again, my name is Jason Tavener. I'm the Executive Director for the Lawrence County Disabilities and Special Needs Board, and I'm also the Chair for the South Carolina Human Service Providers, and that's the capacity I'll be speaking to you today on. I think I was just listening to Elizabeth, so I'm sorry, I was not quite ready. I thought she was still going. But I want to also, as she did, thank the Commission for the opportunity to speak today. The South Carolina Human Service Providers advocated for the renewing of the practice by the Commission for public comment, and we commend your continuation of this portion of your agenda. At the August South Carolina Human Service Provider meeting, we discussed the path moving forward with DDSN and the Commission. Our goal remains to work with DDSN on the vital issues that are facing our industry and the people that we support. Today, the Human Service Providers have 53 organizations in our group and represent around 30,000 people that we support and their families. Along the lines of working together with DDSN and the Commission, we created an action plan. I was really excited to hear your comments during the Commissioner portion. I think they align well with what we've outlined here, and kind of our goal is communication and how we can foster that. So we have 6 items that I'd like to go through with you and give you an update on what we're looking to do. So the first item is next week, we hope our goal is to distribute to all Commission members and what we're calling an orientation packet that is designed for Commission members that has background information on the South Carolina Human Service Providers. To kick off this effort, again, we would normally send this to new Commission members, but we want to send it to all of you to kind of start fresh. And as an aside, I would like to, on behalf of the Human Service Providers, welcome and thank the 2 newest Commission members, Commissioner Miller and Commissioner Rawlinson, for your support and for your service to South Carolina. So we will send out those packets next week, I think by email and maybe mail as well. The second item, and this has already begun, I was so excited to hear this referenced earlier. I'd like to thank Commissioner Miller and Rawlinson for participating with the PD providers, and I think Commissioner Thomas, along the lines of what you were saying, we do plan to extend the invitation to all Commission members to our regional meetings. So the South Carolina Human Service Providers is aligned with the old DDSN model of Piedmont, Midlands, PD, and Coastal. So we still align ourselves that way. And the region chair from each region will be reaching out to the commissioners for their area and inviting all of you. So all of you should get an invitation at some point to our regional meetings. I would like to note that there is some geographic overlap. So you may get invited to more than one region, and of course, if you have opportunity, I'd love for you to participate in any that you can. Our third item, and this will be included also in the email next week or in the information next week, is I'd like to reference you to our website, the South Carolina Human Service website. Of course, we'll give you that link in the email. I think on that website, things I'd like for you to note is there's our contact information for members, who's part of our organization if you need to make contacts. There are position papers that have been approved by our membership. I think both of those could be a useful tool for commission members to understand the provider perspective on very important matters. Our fourth item that was discussed at our meeting was we are forming a small group from our finance work group. So we have work groups already existing, but a smaller group within that to work with DDSN on the Band B and I conversion. Providers across the board, we're very happy to hear that we will have a seat at the table during this very important discussion. So I'd like to thank the DDSN management for the opportunity to participate in the discussions about the Band B and I conversions. Our fifth item that we discussed in August was the human service providers signed on to a letter that was generated by ANCOR to the Centers for Medicare and Medicaid Services. And that is along the lines of our support for retainer payments and their extension, as of course this pandemic is extending to the fall and winter of 2020. ANCOR provides advocacy at the national level for over 1,600 providers, and I know this is verb, but their website is www.ancor.org, anchor.org. They are also a great resource. I mentioned that for commission members, you may want to check out their site and see what's going on at the national level. And lastly, as Elizabeth did, and as I think others may do, we are encouraging our provider members to speak at the commission meetings during public input time so that the commission members can hear our perspective on the items before you. Again, I would like to thank the commission members for your service. And I try to close this way every time, and wrap up. I would encourage all commission members to either through the regional meetings or whatever capacities to continue to meet with providers in your area and gain their input into what's going on. Thank you.
Thank you, Jason. Does anybody have any questions? Okay. Thank you, Jason.
Appreciate the opportunity.
Thank you.
All right, that's the end of the public input. Next time on the agenda, we recognize Fred Payne for the presentation on the Access and Mobility for All pilot program.
Yeah, come on up. So Fred Payne is here with the CA4I entity, and he has been instrumental in assisting DDSN with the project that we're collaborating on. And so we've asked for them to come and present to the commission in regards to this very exciting project that I feel is going to spur a statewide opportunity to address mobility limitations that we have in our provider network. And also on the agenda a little bit later, we're going to go over the actual grant award that he's going to be speaking of, the Mobility for All grant. So I'm pleased to have Fred here, and then Steve, I don't know how to say your last name. Yaffe. He has also been very instrumental in this, and I'm really, really excited for them to come and share some of the really neat things that we have going on in the state of South Carolina that Fred has been, I call him the bulldog. He is very, very dedicated and committed to this. So thank you, Fred, for being here. You can just advance the slide here with that. Thank you. That's fine.
And Steve, in order to maintain our social distancing, if you want to come have a seat over here, I'm just trying to make sure that we have plenty of space.
That's what this is for.
Yep.
Stand by.
Thank you.
There's also a microphone there too, so if you speak, they will hear you.
Great.
Thank you, Steve. I appreciate that. Fred, recognize you. Thank you for being here.
Thank you for the opportunity to be here. I want to recognize my friend David Thomas from Fountain Inn. So I didn't put you together on this board until just now. So this is actually a Fountain Inn focused project. And I want to thank, we provided you all with a copy of the grant. You don't need to look at it now, but you're going to have some questions. But these are 9 pages of answers that you can look at later. And it's a public document, so but this is what we said we were going to do. We're so excited. We've been funded for $326,000 to help us solve what we're calling here in South Carolina, Carolina's CAMAC, Carolina's Access and Mobility for All Coordination Pilot in Fountain Inn. And so CAMAC is CAMAC is the way I'm pronouncing it. And so it's a CAMAC pilot in Fountain Inn. Let me tell you, when I was elected to county council in 2006, I had no idea that I was going to be involved in transportation the way I was. But shortly after I became a councilor, the local bus system, Greenlink, had a major problem, and they said, we're on the edge of a financial fiscal cliff here. We're looking for solutions, and they asked the county to help. So we got involved, and I asked a gentleman who was living in Greenville, but who had served in an executive position in Washington, D.C. in the transit system, and I said, from your perspective, what is the solution to transportation? And he said, Fred, in every community, one hand has to wash the other. When we wash our hands today in COVID, we don't do it one hand at a time. If we wash together. And that's really the solution. So this slide, we divided it into 2 slides, but several years ago I spoke to the Transit Research Board at a meeting in DC, and they said, we want you to take 1 slide and tell your story. So here's 2 slides that tell the story, and then I'm going to ask my colleague Steve to help follow up on that, because he's been in the transportation business for 35 or 40 years as a transit executive in communities like Arlington, Virginia, and Fairfax County, and Houston, Texas, and other places. But he lives now, he's retired and lives in the Rock Hill area, so he's a South Carolinian, and we've engaged him as a consultant with us, really a volunteer consultant. So the slide says our mobility needs generally are people need access to jobs, to health, to nutrition, and to their community. And we're trying to meet those needs, and the variety, we see a variety of solutions. We're going to use vehicles like Fast Tran. We're also going to use smaller dash vehicles. That's a picture of a vehicle operating in the Chicago area, but they want to come to Greenville, Fountain Inn, and help bring that kind of a vehicle. That's a little Nissan. The other one is a Toyota operating down in Charleston Green Taxi. You can see on the side of the door, and they're willing to come to Fountain Inn and Greenville to help us. On the right-hand side, we think that a big part to meet the needs, we need to use mobility solutions technology. And there's a lot of innovative changes that we need to make. Organizational changes, regulatory changes, but technology changes are going to help us lead the way and provide opportunity for that. And so, to do that, we began we really began about 2020, but in 2016, the chairman of county council asked me to lead up an effort to use innovation for economic and community development. And so Butch Kirby, we created a 5-member executive committee with this Carolinas Alliance for Innovation. That's a little gray circle in the middle. And we've gotten a grant now, the FTA Mobility for All, and they use M4A as their little summary of it, for their funding program. What we provided is a consortium of public and private partners deploying Rides Plus Mobility for All, initially in Fountain Inn, but ultimately we hope across the state of South Carolina. So if you look at who's involved, well, on this particular grant, the little green circle, FTA is putting in $326,000. We've got some local match, well over 90,000 is committed. On the right, blue circle, South Carolina TDSN, Chris been very, very supportive. He wrote a support letter for this grant, and I think was a key reason we got this. But other HSAs, and then above SCDDSN, Thrive, the Greenville operation, Thrive Upstate, and the Lawrence County DSN board. They have been very effective. Jason was very active in getting us involved, saying we have a real need in Lawrence to solve some transportation problems related to our clients, our consumers. So we did that. Well, we've got other people, Dash, I showed you a picture of Charleston Green Taxi and the Dash vehicles, but we would use that kind of thing. We've got county, we've got GPAPS, which is the local MPO. We've got ACOG, which serves rural counties. We've got GTA, which is Greenleaf. All of them are involved, knowledgeable about what we're doing. They're engaged to the point that they need to. When we need them, we engage them. We've got MOUs with most of those, all of those. Academia, Clemson ICAR is in Greenville. Clemson Maine University is 35 miles away. They're all interested in that. I had an email yesterday asking us to help them on a grant, just because we do that kind of things. We're a coordinator. And then over on the left-hand side, corporate people are interested in what's happening. Companies like SoftServe and Demand Trends and others, they develop software and solutions, and again, they're going to be a part of it. And then other local foundations and companies are going to help us. So I'm going to ask Steve to come and carry us forward. So Steve, I'll let you.
Some of these slides, down there. Some of these slides speak for themselves, and I didn't make up this statement. We've been using it in the industry for quite a while. Services are useless if people can't get to them. This is what we want to get away from, and you can see by the lack of professionalism that I made this slide myself, but this is a problem we have in several states, including South Carolina, where we have separate fleets for specific groups of drivers for specific needs. And as an example, this is a Google map aerial view of the coastal center where you've got buses parked at the site midday. So, you know, the situation we have going back to this one is we've got 130 federal programs as well as hundreds of state and local programs across the country funding specific transportation for different clientele groups. And then the vehicles aren't used all the time or used effectively. So this is where we want to go. United We Ride was a campaign that FTA led several years ago. But the idea is riders funded by a variety of agencies sharing rides, where we group rides and schedule them by geography and arrival departure time, not separated by funding source. Now, we recognize that COVID is a temporary obstacle to ride sharing. We've improved our techniques for cleaning beyond the picture there. But we schedule rides, mostly be regularly recurring trips. We have informed customers about our vehicle sanitation procedures, and drivers would have proper protective equipment so that people are, as we recover from this temporary epidemic, that people will be willing again to ride with each other. And we dispatch rides real time. That's a tablet on top of a dashboard. So while rides would be scheduled to a vehicle, if something happens, there's a delay or for one vehicle due to traffic or another vehicle has an opening due to a cancellation, we can reassign it to a different vehicle to improve that on-time performance. Now, our strategy is partnerships. Nothing gets done without partnerships. So we would partner with human service agencies, private sector employers to implement a coordinated system for older adults, persons with disabilities, and low-income citizens, using a mobility as a service model to book, schedule, and assign rides. And that would enable the partnerships shown on the slide with employers, agencies, communities, technology is key to our approach, and the technology isn't revolution in my industry. It's just transformative. And most of my career I've worked in public-private partnerships because it's just more effective. It gets the job done better. And here you can see our strategies that we would use for employers. Again, recurring group rides to and from entry-level or basic jobs. Agencies, so DDSM, shared rides to programs and services where people would ride together, and then you stagger the use of vehicles. This is something I used back in my Fast-Tran days, where we would have rides for people, DDS and adult day healthcare, and then after that, rides to senior centers, and then midday we do group shopping trips, and then do it all in reverse and dialysis all day long. Healthcare providers, and all be app-based, and you know when your vehicle is arriving, that estimated time of arrival. So we've got a map here showing, got a fountain in the upper left for Fountain Inn, and then we have those periscope symbols for where the training centers are. So we initially focus on Fountain Inn and then include accessible vehicles so that folks who use wheelchairs and scooters don't have to wait longer than anyone else for a ride. And we assemble vehicles from a variety of sources and providers, including Thrive Upstate, into a network where we could serve the rides that are being provided and add rides. You've got 11,800 potential rides, some of which are being provided, but there's more rides. I want to take this slide as an opportunity to applaud the success of South Carolina. According to the 2020 UCP scorecard, South Carolina has been more successful than the nation integrating consumers in the workforce, community-based employment. But there's more of a demand that's being met. And the difficulty is getting people to and from that work site. By reassigning transportation and fleet management to Rides Plus, DDSM can add focus on consumer services, and more consumers can reach employment. In other words, we can take care of the fleet and the transportation. Each agency with vehicles, with people on board would be charged proportionately. Operating costs can then be spread over several agency and corporate customers. We could also run vehicles off-peak for second and third shift workers. We can basically provide more rides with available equipment and within budgetary limits. Now, we have to recognize in South Carolina we have some structural issues. Silos discourage efficiency, and we have silos in South Carolina. DDSN network has a fleet. Aging, area agencies on aging mostly contract out for services. You've got Veterans Affairs. I mentioned 130 federal programs. They're active here. There's an inability to share resources and rides, and resources are not being used effectively. My general comment on the logistic care model is that a capitated rate for transportation encourages poor service because they're not incented by the financial contract for rider satisfaction. And then vehicle procurement and insurance coverage is disconnected from mobility needs. There are ways done in other states where you can add on. Well, South Carolina already has an insurance model. They use it for Uber, where your basic insurance goes so far, and then the Uber insurance actually covers the overage. That's a model that could be applied to social services as well. So we're interested in your comments. We're interested in your advice. We believe we can get a lot more bang out of the bucks being spent on transportation. And that's our contact information. I ran through that rather quickly, but we're glad to answer questions.
So thank you for the opportunity to be here. Chris, how'd we do?
Excellent.
So how about the board? Do we have time for questions or?
I think we have a couple of questions from anybody.
What's the definition of silo?
A silo?
Yeah.
I'm gonna let the expert here.
DDSM, to be frank, is a silo when it comes to transportation, because you have a set of vehicles only used for one group of clientele. Aging is another silo. And some, on the federal level, there's an attempt that is called CCAM, Coordinated Council on Access and Mobility, which has been replicated in Virginia and several other states. Virginia, where I worked for almost 30 years, either Aging or the Community Services Board, which is your counterpart, will add systems for transportation, and they work together, and they grow those, especially in rural areas, into public transit systems that would continue to serve the demand response needs of the agencies plus the general public. So Virginia's been pretty successful in getting rid of the silos. FastTran, you saw a picture of a bus. That's a consolidated human service transportation agency for Fairfax County and a couple of cities in that area. Everything goes through FastTran. The rides are provided. They're not exclusive rides. One vehicle just for one group, unless it's an off-peak group trip. We split the cost according to the number of people from each agency on the vehicle.
So, does that answer your question about silos?
I'm gonna tie it into, one additional question. How does that tie into RTA? How do you classify RTAs in South Carolina?
Well, regional transit authorities can be one or two counties, I think.
Sumter County is one,
And,
Lawrence County is another.
yeah. There's, I've looked at the provision in state law to set up one. It's easier if you build up gradually before setting up an RTA through cooperative agreements, in my view. It's, we took it as a step-by-step process in Virginia. Our model could also serve people who want to pay a fare, as long as it's online. We're not looking at cash fares. And include dial-a-ride type trips into our model and mix them in as we go. A lot of rural agencies across the country have taken that approach. They are regional transit authorities. They serve Medicaid, especially in states like South Dakota where we don't have the capitated rate model. They serve, they get federal transit administration 5311 money for rural transit. You can mix and match resources and get, and provide more rides within budgetary limitations, but the advantage of an RTA is you can access a multitude of financial resources.
If I can add one comment, we have engaged Doug Freight and Johnny Manwicki at DOT. They are at the table with this as well. I don't know if they are on your partner list. I can't remember if DOT was on there.
Well,
But we are engaging Department of Transportation as well. They have access to some CARES Act funds. So we're trying to bring all parties in that have transportation as part of their mission.
Now you talk.
so,
We're trying to, basically, they'd always be trying to subcontract with DDSN to do some transportation. Is that what?
Well, there's different ways to do it. We'd like to explore that with DDSN. Use vehicles off. Your sites may not be located near other sites where you could group rides very well for the training centers. Thrive is probably different where there actually is other sites nearby their facilities. But the idea is, let us take care of the fleet, work out an arrangement, so that it actually, you defray some of the costs of maintenance, certainly, because you've got other funding sources and other riders to handle that. So we look for a financial arrangement to use your vehicles more effectively.
It sounds like we're gonna leverage our equipment to better integrate our folks, because having transportation for jobs is very, very difficult, especially if you work an odd shift. So anytime we can utilize equipment that sits, I was a provider for a very long time. Our vehicles sit all weekend long from the day programs. They don't go anywhere. So if we can leverage some of that for someone who has a weekend job and not utilize staff, that we can actually have somebody in the community be part of that transportation pool, that's not a bad idea. It's a really good collaborative effort that might help people keep jobs a little bit longer. Transportation is a huge issue. I applaud Tyler and Jason for getting in on this and starting to look at this as an alternative, because especially in those rural counties, there's not many other alternatives. I mean, even when you start talking about taxi services, not many, and it's expensive. So I think this is a really good way to leverage equipment that might be sitting otherwise, to get our folks involved in the community. And let's talk about final rule compliance. This is it in action. This is actually helping people ride with somebody that's not in their group home. Somebody, you know, if they're able to do that, because one of the reasons we do have, quote, the silo is because some of our people require certain supervision levels, but not everybody does. There's lots of folks that are independent, more independent, and can be at their job. And if somebody else can take them, it'll also leverage our staffing issues. Because when you have to go drive people here, there, and yonder, that staff is taken away from their direct care duties of the other folks that are left behind. If someone's able to go, then we should be fostering that independence as much as possible. That's what we're in the business to do. So I do think this is, it's nice to hear. What I want to hear is sustainability as we move forward, because once we make promises to our people, I don't like to fall back off of those. So if we can push this as much as we can to create a sustainable model over time, so that if someone has a job, they're allowed to have that job for 20 years like the rest of the people have, you know?
That's why the fee structure and the coordination is so critical. And as we've looked at, like at Lawrence, many routing inefficiencies that generated significant staff and vehicle savings just from looking at where everybody needs to be picked up from and capacity in vehicles.
Right.
So they bring a lot to bear. And yes, we talked about that yesterday when we talked, or was it yesterday? Just making sure once this FTA funds are gone, that we're not done with the project, because it's a one-year grant.
Exactly. The grants may help us get started, but we've got to have sustainability, because the thing is, if everybody puts their money into the same pot and we try to provide transportation for all people within that, it's mobility management, and there's actually a National Council for Mobility Management that's promoting that. And Easter Seals is a national organization. They wrote a support letter for us for this grant. They've also wrote I've written 5 grant proposals in the lab since January and submitted them. Now, we don't know if we're going to get any of the others, but we know we've got this one. We want to do a great job here in Fountain Inn. And we're asking David Thomas right now to be a part of our make that happen in Fountain Inn, because the money has been appropriated. We don't have the approval to use it yet because we have to get through the GPAT STIP program and then the state STIP program, they call it. But once it's there, October 1, which is coming up pretty quickly, we should have money available that we can access.
And there are some communities that would need such a service. So when we look at it, and the good part is the fact of bringing in DOT, because they can bring those pieces together that can make it work very effective. When is the rollout?
Well, we'd like to do it before October 1st, because we have private employers that are saying right now, we've got 50 jobs, we've got 500 jobs, at least 50 to 100 of those people that we're going to hire are going to have transportation challenges for reliable transportation. If you give us the vehicles and the drivers next week, we can begin to fill them up. So transit, Fountain Inn is what they call a transit desert. It has no public and really no private public type transportation service. Uber says they serve it, but if you ever try to get them to come to Fountain Inn, they say service is not available today.
I'm driving for Uber right now.
Are you?
Yeah, that's a joke. But
we hope you'll drive for us.
It is an issue, but here's the question I've got that maybe Mary can help me with. For instance, we've got 15,000 approximately clientele, half of which are on campus, but half of which are come from their home. Mary, are my numbers, how are my numbers? 7,000, 8,000 that have to do a transit from home as opposed to being residents?
Oh, the folks that are living at home going to like the day program?
Yes, ma'am.
I don't really know it.
I gave them rough numbers.
Okay.
Steve, flip back to that slide. It's got the number on it.
I think the number will be somewhere around 7,000 or 8,000, something like that. That's
Yeah,
what we're up
7,300,
against.
There.
How much?
7,300.
Well, I said 8,000, thank you very much.
But that might
Okay.
not be all the folks, yeah, but there's also employment issues you could add to that number.
Right.
Now, how are they, I mean, from a policy perspective, I presume what we would do is analyze, well, how are they getting there now? You know, parents could be taking them or something like that. But there are also, there are services that exist, because I just had a conversation with somebody who drives and does pickup in Greenville County, and he is working, I mean, that's what he does all day long. I mean, now things have changed obviously through COVID, but he works for a company that is contracted.
Is it Southeastern?
I don't know the name of it, but.
So we're willing to work with anybody. I mean, we
Well,
we want the drivers to be qualified, vetted, you know, safety, courteous, all of those kind of things.
So how would you integrate, Fred, with the contracts that currently exist, say with the Greenville County DDSN, that have a contract with 3 companies and they pick up a total of 750 people and then take them home? So it's in a sense kind of like a specialized taxi service.
So Mary can answer that question.
We don't have providers doing that.
Providers don't, the
They have their
providers
own
are
fleet.
providing their own transportation. That's why we talk about the vehicles sitting on the weekends, because they don't provide the transportation on the weekend to those home communities.
Yeah.
But they're doing door-to-door service now for our individuals, like Thrive, it's picking people up.
Yeah.
They have
contract.
BDSN employees that are maybe a social caseworker making $60,000 a year or whatever, and they then are driving vehicles because they need a driver. It's an efficient use of drivers, but it's not an efficient use of the professional
So
staff.
what we're saying then concerning let's get real specific. The guy that I just had a conversation with that picks people up, and I asked him, I said, who are you picking up? Is it Department of Disability clients? And he's affirmed that yes, that is. So it's but that's an independent company he works for.
They work through Logisticare.
Yeah,
They get funding
Logisticare.
from Logisticare.
It's a Medicaid service.
So with the vision, if you look at the picture on the lower right, every vehicle in the program, regardless who owns it or who employs a driver, would have a tablet. Rides would be grouped separately, dispatched, so he may have a different mix of drivers. If it's more, a mix of riders, it's more efficient to do that. Some of his current riders may be on a different vehicle, however it works. But we'd be mixing and matching basically. You've got in the transit, we have an intricate phrase, butts and seats. That's what we're trying to do, is to fill the vehicle. So what we need to do is once FTA says that we're fully registered in the project, and they have a bureaucratic process we have to go through. And Fred mentioned the tip and the step to get into that. Once we're in, they'll let us spend money. We have software partners to put together what they've got, what they're already doing to make a network for us. And the scheduling algorithms already exist. We get the operating companies on board, we get the tablets in, we make sure that everybody's trained properly. And we'd have to assemble a supervisory team or work that out. And then we'd be ready to go with a mix of vehicles to meet different needs. And that's why you may need some bigger vehicles that are wheelchair accessible, and smaller ones as appropriate.
And the reason we got involved in this is our providers have their own fleet, but there's a lot of needs that our population has that are outside our operating hours and outside our programs. For example, if they live at home, come to our day program, but then they need to go shopping in the evening, we don't provide that shopping trip. So this company can be providing that transportation to our folks in the evenings, on weekends, or to other needs.
But we have a tremendous problem with it, that people can't work. People could work, but they can't get to work.
Right.
And that is one of the big things we need to try to do, because if somebody is working that's disabled, they can give back to this community instead of just always taking from it. And that's why I think this is a wonderful thing, because people can get to work and be a wonderful part of the community. And what Mary just said about this is a plan in action, can't remember what you just said, but that should be a slogan of this organization, because it is a wonderful example of how people with disabilities can integrate with others. It's just it's a wonderful thing in general, but we have to start in York, and start in y'all's county and see how it goes throughout the state, I hope. But in the interest of time, we have to move on.
We've got
I
to
would
make
say
it
Commissioner
fountain in. Go ahead.
Yeah, I just wanted to say, this is a great program. I have a daughter who is a quadriplegic. Thankfully, she drives herself, but then for many months she didn't. And trying to find, when we were, for example, in Atlanta, trying to find a taxi that could move her in a chair was complicated. And even when we go places, finding, if we're traveling, we can't call Uber to just pick us up. I mean, we have to think those things through. And this is a very much needed program, and I commend you for taking the time to figure it out.
And
So-
can I just say one thing, because I can see questions in David's eyes. There is a myriad of different transportation fixes. Some counties actually they contract with a company like Logisticare to move folks. Other folks, they do it all with their own vehicles. In my experience, the companies I worked with had their own vehicles. I think what ultimately it comes down to is it's not going to be for everybody in the programs, but it's going to serve a lot more. Plus, we can also get folks more involved in their community. Again, sustainability is always my issue, because again, promises made and not fulfilled are the worst kind. So my feeling ultimately it always comes down to the individuals we support and making sure, and work is the best place to start the shopping trips, things like that. But to Ed's question, silos are inefficient. We have found them in this building when we have departments that are siloed. It is very inefficient. It's a waste of resources. So if we could do something that could leverage our resources, that's the way we need to go. Yeah.
Good question. Is something, I can't see.
It's what?
That's the whole state.
No, it's Sumter County on that.
That's the entire state.
It's not one of the target right now.
So,
Those are the regional centers. Those little points are where the regional centers are located.
I think the initial project is just out there, and then success there means we expand it.
Right.
Yeah, I just want to make, I couldn't read Sumter, just making sure.
Yeah, we didn't remove it from the state. It's still there.
Chairman Banks,
Yes, briefly.
it is very brief.
We're way over.
30-something years ago, when I got one of Greenville City Council, my very first sort of project, because they were having trouble, was Greenville GTA, Greenville Transit Authority, which was a Greenville bus system.
Right.
I have never walked into anything that was such a morass before or after. I mean, transportation is a hard nut to crack, and Mary is exactly right, because we had a number of combinations and permutations over the decades with GTA trying to get, once we dumped Duke and had a company that took over GTA, unlike Harper, then they bailed out because they went bankrupt. Then we had to start all over again, and she is exactly on target. It's sustainability, because there's some kind of system in place now where people are trying, even though, as Barry points out, it's probably unsuccessful in many features. But the issue, Fred, I think is going to ultimately be, if you get rid of the current existing system, if you can call it that, and go to something else, then should it fail, or should there be hiccups in that, then we're having to come back and try to recreate something. So her admonition of sustainability, I think, is right on track, because that's what I saw glitch over and over again in Greenville. And you remember all the history of that for headline articles.
I do.
Yeah.
So great summary, great experience. Here's the deal. There are three basic barriers that we have to overcome. One is technology. We pretty much have solved technology issues. Okay, 90% of the technology is available now. The technology, we got a company out of Columbus, Ohio, to look at the 170 people that Lawrence County was bringing into their center every day, their training center. They were using 29 vehicles. They optimized the routing, and they said you only need 17 vehicles. Now, that doesn't mean that they don't need them, but they got to have at least 17 to do the job that they're doing now. And the other 12 then can be used for something else, maybe as a source of income for that agency. Now, so the second issue is regulatory, legislative
issues that in some ways, the silos are set up by legislation. I mean, they say, if you get this money from this agency, you can only serve this population of people because they want to make sure they protect that population. So that's the second barrier. The third barrier is human behavior. David, the problem is with buses forever has been they don't pick up people where they live and they don't take them where they need to go. And if they don't do that, people choose not to use the bus. You can't change that. You can say, well, we're going to spend more money or we're going to do it more frequently. In Greenville, the service is basically every hour. That's not enough. If you miss it, so the human behavior, though, becomes a factor. We don't know how people are going to react. We don't know how regulatory issues are going to be dealt with. We need you all as a support. Chris is a great support. I'm so glad to hear your director say what she did because she just said what the problems are. But we need your support. It's not something that we come in and provide the answers. We only can do it with partners. One hand has got to help wash the other. So you all understand the needs. We thank you for the opportunity to be here.
Thanks, Fred. Thanks, Steve. Appreciate you guys being here and making this presentation.
If you all want to attend the rest of the session, you can go to room 180 on the first floor. It's right next to where you came in.
Thank
We'll
you. I
listen in
appreciate
from
it.
down there. Thank you.
Nice meeting you.
Ms. Pooh.
Thank you.
Appreciate it. Thank you.
Thank you. Okay, moving on. Next item on the agenda is the commission committee business section. I would first call upon Commissioner Blackwood with regard to the finance committee update.
Okay, thank you. We spent some time in our Finance and Audit Committee meeting on August the 6th talking about the Internal Audit Committee charter as well as a directive referring to general duties of Internal Audit Division. And we voted to table the discussion until we had more time to look through the charter and the directive. And so that's an update regarding something that was new to the committee. We also talked about the federal grant application and the charter, the federal grant application and change policy during our committee meeting, and we asked the staff to suggest the changes and edits and bring it to the full commission, that particular policy. So the other item we talked about was the PPP, provider relief funds. The agency brought to the committee a recommendation to possibly submit an RFP for an auditor to come in and look at the 36 DDSM providers in terms of the funds, the PPP funds that they might have applied for. And so we just kind of got an update on that in the sense of the agency has asked the providers to basically self-report if they receive the funds, and the staff has been looking at really guidelines from the federal government and the Small Business Association to determine what guidelines there are regarding cost reporting for the providers. And there was a little bit unknown in our last meeting about that process. So we will continue to get updates from Chris and others at the agency on helping us understand that so that we can get a handle on that issue. We also discussed the CARES Act, CRF, which is the relief fund, and the agency kind of reported to us that they were going to look into applying for provider relief funds, and the committee supported doing that as long as we are eligible for them. The agency is, and we can return the funds if necessary. So that was the update, the main updates from the commission meeting, not commission meeting, but the committee meeting. Let's see, another item that we talked about was the capital funding, community capital funding opportunities. With the master lease program, we've had a lot of discussion about the concern of borrowing money through that program. And so the next step on that was for Mary and others to check off with some state legislators to see the impact that might have on the agency. Should we borrow money, which is a concern, I think, by several on the committee. So we discussed that, and I believe those are the main highlights from that meeting. That's all I have to report.
Any questions?
Quick question I have from Commissioner Blackwood. You're the appointee to the Greenwood Genetics Center. Have you had opportunity yet to, as our quote unquote eyes and ears, as I don't know if you're ad hoc or how they consider your membership, to attend any of those meetings and try to get a grasp on what exactly they think they're doing for us as and our clientele?
Yes, I have attended one of their board meetings, and I made a visit to the campus, the Greenwood campus, about a month ago. And I am definitely diving into, their programs, their concerns, their issues, and don't have anything specific to report right now, Commissioner Thomas, on this, but it's a ongoing work in progress kind of thing that I'm putting my attention to and trying to get a handle on things. Chris and Pat have definitely, and Mary have been helpful in helping me kind of get my arms around the relationship, the past, present, and then kind of what needs to happen going forward, so that we have a continual communication with them and understanding on things that that affect their programs and how it connects to DDSN. So that's
as chairman of the newly, thank you, Mr. Chairman, for the appointment, but I'm chairman of the legislative committee.
Yeah.
And I had made, just FYI, I had made a contact just to find out, because this came up, Mary, if you recall, like I guess a couple of commission meetings ago, something like that, if the group remembers, exactly how the funding transfers through, but also money comes out of our operating. And a pretty substantial amount of money comes out of operating to go to Greenwood, and this has been going on for many, many years. I don't know of quite a similar story in other agencies. I presume it exists and all that, and I had made inquiries. And when you're messing with somebody's funding sources, you want to do it with a certain amount of, I presume the term might be sensitivity. It is controlled, just FYI to the group, by a proviso in the state budget. A proviso goes through every year with the budget. That would be on a yearly basis. So this is not in code law, but the proviso carries on a year-to-year basis. All your provisos in the budget, state budget, carry a 1-year reality of as if it were in the code for a year, and then it has to be rolled over Same proviso, for the next year. And I had inquired about that, just, what's controlling here. It is a year-to-year proviso. If that's going to be dealt with in some form or fashion, reduced over a period of time, increased or whatever, it's going to have to be done via the Ways and Means Committee in the House and the Senate. And, even though the individuals that might have propelled this money transfer, and I think the total is $7 million altogether, inherit with the pass through as well as out of our operating budget. That money, no doubt served a good purpose in helping Greenwood. The question is, what is it doing year by year to help our clients? And so it's something that I think we'll address. It's an election year. My suggestion, FYI, to follow through on previous discussions that we had in the commission, was that probably this would be a bad time to bring that up. It might be good to look at the governor's executive budget and have his team look at where what the benefits are exactly to the agency vis-a-vis a private corporation. That's why, Commissioner Blackwood, I asked, start focusing on that, because hopefully in a year or so, we'll have some focus coming from the eyes of the governor's office to help everybody. And if we think as a commission, it would be nice if we said, we really believe in this, it's helping us a lot, people are benefiting from the genetics program, and can quantify, and I want to really emphasize that, can quantify the benefits to justify the expenditure, then I'm happy with it. But that's kind of what I'm looking for. And so thank you very much for paying close attention to what was brought up a couple of months ago, and where I think an executive budget analysis will probably require of us. Thank you. That's all I've got, Chairman. Thank you.
Thank you. Anything else?
Very good, David. Thank you very much.
Thank you, sir.
Thank you, Mr. Blackwood. All right. Moving on to the next item on the agenda is the Policy Committee update. Recognized Commissioner Malphurs.
Thank you, sir. I also appreciate the opportunity to be here at the Finance Committee, and particularly Vice Chairman of the Board. It's very kind of you all to have the kind of confidence in me to do both of those things. And in that regard, I'm going to go over very quickly, as quickly as I can, because in the interest of time, we are, I'm sure, quite behind. So I'm going to go as quickly as I can through the proposals that we made to the Finance Committee that we're asking for approval today. One is that we have a new policy relating, we do have a new policy relating to public comment. However, it's a policy because it's never existed before, but we're going to have one now. It talks about several different things, but the primary thing is that it says that we are we have no obligation to have public comment in any way, because we're under the Freedom of Information Act, and it says nothing about that in there, to the commission, but we are going to do it as a courtesy. And we put some guidelines in there about how many minutes each person can speak, which from this, if we approve this today from this meeting on, it would be 3 minutes per person, up to 4 people, and if we decide to do 3 more people, it would be 3 minutes more. Or if the commission votes on the next 3 people, then that's the way that would work. And I'm sure everybody's read the policy, and we're just asking that we would approve that policy under the assumption and note that anybody in the provider association, or anybody else for that matter, can contact us at any time. So through email and things of that nature. So this is just a formal way to speak to us. It's not an informal way, as you can email us anytime. So is there
So we'll treat that coming out of committee as a motion and a second to approve this particular policy?
That's right.
Okay. Questions? That motion and second being recognized coming out of committee. I have one. How do we settle on 3 minutes?
Well, that's the way it was in 2006, 2006 or 7, whenever they started it. And then it went to, in 2016 is when my predecessor went to 7 minutes. But I can understand the history, so it went back to the way it was before. And we thought that was excessive amount of time, really, for one person speaking. When you talk about most places like this, 3 minutes is what they normally receive, so that's why we set up.
3 is a little short to me, and I just say that, there's not a whole lot you can say in 3 minutes. 7 may be too long, I don't know, but 3 to me, I was gonna say 3 to me is a little bit short.
Split the difference.
I probably would have settled on 5, but that's just my opinion on that.
Mr. Chairman and Barry, is there a way that if someone is speaking, that the commission can say, okay, we give you an additional 2 minutes? Is that allowed?
Well, they could give their other 3 minutes to another person if there was 2 people that signed up, somebody could say, well, I'll wield my 3 minutes to this other person, which would give them 6.
Okay.
This is just a way to keep that in perspective, and also, it's not to say that we could not vote to allow a person to continue further if we wanted to. But it's just, I mean, as you can tell from the comment we had today, it just takes a long time, and we have a lot to do, and we have a lot to get to. So we were just trying to curtail that to only the most specific issues, because if they have a long thing to say, they can say it in an email or a letter or whatever, however else they want to contact us.
And typically, as it has evolved, it hasn't been a hard limit enforced by the chair. They've typically given a fair amount of latitude for people to go over.
Yeah, that
unless
Right, they are given latitude. I mean, we're not going to be rude unless we have to be.
Right.
Unless people are rude to us, which happens sometimes, but as long as they don't do that anymore, we'll be all right. I don't think anybody's going to I don't think we're going to have a stopwatch unless we have a serious issue. But it just means if we do more than 3, then that means they can have more than 3. And if we could go to 4 or 5 and give less latitude, but I think it's better to get 3 and give a little bit of latitude. Is the reason that we talk about that, and I don't think anybody on the committee was opposed to it. So we can do whatever y'all want to do. I'm not saying we can't. It's not a hard and stone rule.
Any additional questions? Okay. Seeing no additional questions, all in favor of approving the policy as presented, please indicate by saying aye.
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 Any opposed? Aye. Me, nay, for the reasons I stated. Any abstentions? Hearing none, that motion will pass, and just Sandra, let the record reflect that was a 5-1 vote, with me being the nay vote.
Mr. Chairman, I'm uncomfortable with not being unanimous. I mean, I think we all need to be together on a conclusion and not, I don't mind losing a vote too, because sometimes we may disagree, but I don't like it when we're trying to get all together on something like this and we don't have a unity. I'm sounding like a convention tonight, but it's not it's not sort of we're all together. Is there something you'd be happier with?
And not no problem.
And I'm not, it's not a thing that I'm violently opposed to. I just, my personal, again, having sort of seen it back and forth and seen some of the comment and knowing and speaking professionally, essentially for, 3 minutes just is not a lot of time if you have something substantive to say. I would have probably preferred 5, but I understand. I'm not opposed to having, a vote of. I like having votes that are unanimous, but I also think it's appropriate if I just
Chairman,
on that whole.
Okay, Chairman, we did discuss this. I mean, we talked about with the permission of the chair. I mean, and let a lot of latitude, and I've seen different organizations operate that way.
Right.
So that you had the chair that could make the cut. Now, Commissioner Malpass has put a lot of thought and a lot of time and consideration into this. And what he's concerned about, if I may speak for Barry, is our time. And that when we've got all these important issues to get to, if it gets tight. Now, what he's done is put a back-end stop on it of, I think it's 15 minutes, Barry, is that the total?
Well, it's 21.
Total 21 minutes with,
we also allow them to add 3 more people if we want to, if we vote to do that.
with the permission of the chair, I think, with the latitude of the chair, I think was built in, wasn't it, Barry, to the wording?
And we just said we had latitude, so if he wants to let somebody go 4 minutes instead of 3, it's gonna be fine.
I don't think we even have to discuss that. I think he would have that authority based on what you're saying.
That's what I'm
We have
hoping.
latitude, unless somebody complains.
Yeah.
It's just, and I don't mean to throw, and that's absolutely, this is what I have asked for as commissioner for a long time, to have a more clear guidance, and I'm accepting of that, and I, you know, but again, as far as, I don't mean that to be any disrespect to the work that was done, by the committee or Commissioner Malford or anything like that. It's just my opinion.
Well, you don't, I mean, I want to make sure that you don't feel like the committee has some sort of way run over.
No.
Okay.
No.
Okay.
No. Again, this is, again, and I'll be the first to say, unanimous votes are great, but I think this commission exists for people to make votes. And if somebody is not in 100%, you know, doesn't feel like a major portion or a significant thing, that's one thing that they just don't want to, they want to vote in opposition to it. I think that's fine. That's my thing. It was not meant as any sort of shot.
I'll conclude it with this. I am on a board of directors where if one member says no, everything comes to a stop and we try to work it out. And that's not what this is, but you know what? I sort of like that. I mean, that's like, you're trying not to let any member feel like they've been shorted. So I'm stopping at this point, but if you're okay.
If I had felt that strongly about David, I could have made a motion to amend it.
Well, okay.
And I fully understand that.
Okay.
I didn't think that was necessary. I just sort of wanted to let my opinion be known, and that's one way that I do it. And we've always had a situation where if somebody just wants to voice some opposition to it, we've always had the ability to do that. And
I agree with that. I agree with that wholeheartedly.
And again, I didn't mean that as any disrespect, and I really appreciate the guidance, and I'm gonna follow it. I just want to let you know what my opinion is.
Okay, I'm fine. I'm fine if you're okay. I'm fine.
I'm fine.
Okay.
I'm fine.
Okay, the next item is, we need to vote on that. Go ahead.
Well, I think we voted on the public input, so we're on bylaws. We're on bylaws, yes. We're on bylaws.
Okay, I'm sorry.
Yeah. Yep, we're good.
Okay, the next, go ahead. Does not need to go ahead. Next item.
No, recognize you, on the bylaws.
I'm sorry,
Yeah, absolutely.
Right, I'm sorry.
You're good.
Next item on the agenda is the bylaws that we have looked at. The first time these bylaws have been looked at since 2007. And they have stood the test of time, which I think is a very good thing. And they are overall a very good set of bylaws, I think. But there was a few little things that the committee felt was necessary to change. And a couple of those were to put from our ends policy, which is basically our governance policy, a couple of things that was in it, which is where the commission, any commissioner cannot have any of his rights as a citizen or any rights given by the governor or the commission. Any policy is not meant to affect that in any way. That was one of the things that we put in the bylaws instead of just in the end policy now. And also that we are, very important to me, is that we are a regulatory agency, and that's also now in the bylaws, as you can read. And the things that relate to the regulatory agency, the A, B, and C in that. The other thing that we decided that we are proposing that we change today has to do with.
What tab are we in?
4.
Thank you.
Sorry.
Nope, my fault.
The next thing that we're trying to change in the bylaws is that, obviously the commission needs to comply with the Freedom of Information Act, and we were just under section 5, it just wasn't clear to me, as to how, that FOIA does trump, and it does, any other issues we would have with Robert's Rules of Order or the bylaws itself, and it just makes that more clear. Most of the work we are doing with the bylaws and many other things is simply to make things more clear and to more, less ambiguity. there's a tremendous amount of ambiguity in our situation, and we're working very hard to make it less ambiguity, and that's what a lot of this stuff is. Truly, it is. It's really not changing much, it's just ambiguity issues, but the other issue is, in the bylaws has to do with, the other issue that I brought up in the bylaws is that every other commission that I've ever been on, every other board that I've ever been on, which is a lot, it's always harder, it's usually been harder to change bylaws than just a simple majority vote. And that's why I proposed that we would make it a 2/3 majority, which is 5 members to vote to affirm changes in the bylaws. Because bylaws is really supposed to be a strong governance policy, and I just feel like it needs to be that instead of just a simple majority of vote to change bylaws, and to have a meeting for that purpose as opposed to just any meeting, because it just could be changed so easily and too easily because it's supposed to be a stronger document. But that's really the only, I believe that's the only changes that we made related to, related to the bylaws.
Coming out of committee, we'll treat that as a motion and second. Any questions or discussion regarding the proposed changes to the bylaws? Seeing none, all in favor, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Those changes pass unanimously. Next item, Barry, for you is the governance policy.
Yes, sir.
Tab 5.
The governance policy, we were simply making the governance policy reflect what the bylaws say, which is the same, which is that, that any conflict that exists between Freedom of Information Act and the bylaws or Robert's Rules of Order, that of course Freedom of Information Act trumps that issue, so the Freedom of Information Act is paramount, obviously. And for the record, Freedom of Information Act is the only thing we're really under. And so that it just there again in a idea of consistency, it just made it more consistent to have it both ways the same way, because it was the same ambiguity I felt like in and the committee felt like in that too. So that's why we changed. That's the only thing we changed on there.
Again, coming out of committee, we'll treat that as a motion and second. Any questions with regard to the proposed changes on governance policy? Seeing none, all in favor, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none, that passes.
Quick question I've got.
Yes.
If you go to the second page, under, it's on the second paragraph, Commissioner, let me just make sure I'm clear on this. Commissioners should request information from staff through the state director. Commissioners may ask staff presenters at commission meetings for additional information or clarification. They've been already, I violated that. I mean, we know people, I'll call Chris up or whatever.
Yeah.
And make contact. I vigorously oppose that. I mean, she's got more sheets of grace over. I shouldn't have to, hey, I got a list of 10 things I want. And, if I got a question for somebody on staff, I should call them. If they don't want to talk to me, they don't have to.
I think we're going to get some training on that with regard to the governance stuff that's coming up. I think that's one of the issues in terms of the structure of the committee. There is the element where, unfortunately, in the past, commissioners have bypassed the executive director and undercut the executive director in certain situations by going to staff, and have also placed staff in a bad situation where the commissioner has instructed staff to do X while the state director was instructing the staff to do Y. And ultimately, the only employee that we have is not any staff, it's only the executive director. And all of the other staff work for the executive director. So I think the purpose of that, I'll just say, is to prevent that sort of conflict from happening.
Then say it. Then say it. That any contact that the commissioners have with staff will have to do communication issues and shall in no wise can be interpreted as directives from commissioners. rather all staff are under the blah, blah, blah. I mean, I don't want to be blocked from having a conversation. If I want to call Sandra up, I want to have to first call Mary to see if I can talk to Sandra. That is asking for trouble. And it's blocking commissioners from being able to pursue just simple informational things without first what if you had, not Mary, she's fine. But what if you one day had a director who just wanted to give the commissioners a hard time? Now they got to follow this, and she never answers them. Okay, now you can't even get information. So that cannot stand. I mean, I will not follow this. And that's going to blow up.
Let's take the governor's policy back to the policy committee and go back to it again.
So now you sort of.
Let's table that governor's policy approval until next month.
Let's just get it clarified. I want to be able to talk to who I want to talk to. I'm never going to give somebody direct. I'm not their boss, but I want to find information.
And I think there's the clash between that. But and again, I think we're going to get some governor's training. That may be perfect. So what we have is a request now, though, from the committee chairperson to withdraw that vote. Okay, rather approve it and table the matter until next month. So.
Well, I'll second if he needs to.
Okay, so let's second that. All in favor of tabling it and withdrawing the previous vote, please indicate by saying aye.
And y'all forgive me, I'm on the committee, but I missed that. I apologize.
Yeah, I was a little, it was that way because, Mary, I think.
It was already in a policy.
It was.
Not getting, yeah.
We've had, and the only reason why I know this is, we've had this fight before. Where, and again.
Somebody misused their privileges, and I understand that.
Yeah.
I got it.
Yeah. People were basically doing end runs, to get their own thing done. And it really, I remember it came to a head because it was this conflict of staff came and said, I'm being told that I need to do this or provide this information, and the executive director is telling me not to provide it. What am I supposed to do as a staff member? That's where
And the only other thing was that a burden, it was, because it was pulling, like, stop everything you're doing and pull all this stuff.
It was.
And that's
it was massive requests for information.
Continuously.
There's a tension here that we can work out.
Yes.
Oh, yeah.
Yeah, there's a balance.
There's a balance.
We need to do it another committee meeting because.
That's right. Yeah.
All you need to do is
we're gonna table it, and have the committee go back and look at that data.
Lots of good guys, but I think we all need clarification.
Yep.
Good, thank you.
Absolutely. Thank you for speaking up. All right, going on to the next item, would be the Public Invocation Act policy.
The only minor change the Public Invocation Act was that, we asked that, committee chairs would also be able to have an invocation if they would like to, basically, at the discretion of the committee chairman. We obviously are not, encouraging or discouraging in any particular way, except to say that they can do it, just because it did not say you could, and it's a big deal to me that you can, if we do. So, and to the majority of the committee, I think. So, we just wanted to put that in there, so that if somebody did want to have an invocation as a committee, they wouldn't think they could not.
Coming out of committee, we'll treat that as a motion in a second. Any further discussion or questions? Hearing none, all in favor of the changes, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none, that passes.
Was there opposed?
There was no opposed.
No. I thought, it's fine. I have no problem with opposed, believe me, as long as.
All right, next item is the dual relationships policy.
Okay, the dual relationships policy is, you'll see there's only one, well, there's two changes to that you can read on here, that, where the executive director and or the, we just added that, the executive director or the, facility administrator or the state director could be brought into discussion regarding a, if we had an issue with dual relationship. And the other issue was consideration, another issue was, to make sure that the people took into account the possibility that if they were not satisfied with somebody's service, basically, that they could, that they want to make, we wanted to make sure that if somebody had chose somebody to do respite services or other services, that it was somebody that they'd be comfortable, not having around anymore. If they need to be aware that if they're not comfortable, what I'm trying to say is if they need to be aware that if they're not comfortable with dismissing the person, if they're not doing a good job, then that's not somebody they need to hire. If it's somebody that's too close to them, for example, there are plenty of people that I am far too close to rent to, and my secondary business is renting properties, and there are people that I could never evict, and therefore, I would never rent to them, and that's just this is what we're getting to here, is that if you cannot dismiss them for not doing the job properly, then please, we recommend you not hire them, is all we're trying to do. At least allow them to be aware of that. And the other big thing about this policy is that it's not really a big thing, we just added it to the end, but as a footnote, we wanted people to reference this policy more often, particularly in respite and other policies, to see that we have this policy and that, and that we have a, dual relationships policy, and to please read that so that they'll understand it, because other than those two changes, I think the dual relationship policy is a very good policy. Somebody spent a lot of time on it years back. So
we'll treat that coming out of committee as a motion. A second, any further discussion of this policy or question?
May I just add, this policy was approved in this version by the policy committee. Because it is a directive, it is now being posted for public comment in this version. So this was just a notification to the commission that this is information on the item.
So we're not voting on. Okay, thank you. Thank you, Susan. Thank you. Thanks, Susan. I appreciate it.
We will be, after the 10-day period, we'll be addressed in the policy committee and then, bring it up next month to vote on.
Mr. Chairman, I was just having a little trouble here, and so I suspect Commissioner Blackwood may have had trouble hearing it also. So just, if we can, make sure we talk.
Yeah, just, Robin, if you weren't able to hear that, basically, we're not voting on this today. We're having to put it out for public comment first.
Got it. Thanks.
Thank you for that clarification.
All right, sorry, that's my mistake.
It's on my list too that we're having a motion on it too, Barry, so don't feel bad.
That's fine. The next one is Adult Healthcare Consent Act, which we are probably going to go back. We just wanted to let y'all know by information basically that we are going to be probably in the October meeting, more likely going to be going through that primarily as well. That will probably be well, it certainly will be the biggest items that we will talk about. I know there's been some issues in the past, I should say, with our Healthcare Consent Act, and we're working very hard to get that so that we actually comply with the law directly and don't say more than we need to say and don't say less than we need to say in these directives.
We did have an item on the agenda about the tuberculosis screening. Do we need to go back and cover that? Or we supposed to have a vote on that?
Yeah, but that's not before this, it's after. Tuberculosis screening is last.
I've got it on the agenda, it was up next.
Oh, sorry.
Yeah.
Sorry.
We don't have a document for review for adult healthcare consent act.
Susan,
Okay, good.
you need to get close to the mic. Yeah, that one's not on the agenda.
That's fine. It wasn't on the agenda. I understand it's for information only. It just wasn't on the agenda.
It wasn't on the agenda, but it is for information only, just to let you know we are doing that.
Got it.
I mean, I could actually spend the rest of the day telling we'll say that and then we'll move on. And I apologize for the length of this, of my committee meeting, but there's just a lot of things that we do. The last thing on the agenda for today is well, and also relating to the Healthcare Consent Act very quickly, there will be We will be asking more than likely for an Attorney General opinion about a couple things relating to them, and we would ask that the committee would be notified as to whenever the staff decides exactly what we have to ask the Attorney General, would they please let us know what we're asking before they send the letter.
Chairman, may I just one quick?
Sure.
We've got some kind of, I recall, some kind of Attorney General's opinion from a number of years ago on the Consent Act. Could we, while our attorney is coming back with what they want to ask, I want to get clear of what we have already asked them before, because this has to do, as I understand, that Attorney General's opinion, and I'm not sure how they mesh together, this one that we're about to suggest to the commission to ask. Listen, this is kind of interesting. All right, who is who in the pecking order when you have an adult under our care, and then the question about what is to be done relative to their well-being, and what pecking, I mean, is there a family member? But if they're already an adult, they're 23 years old, then what order does it fall in? And that previous opinion, I think, set that up. So what are we asking?
There was a problem with this. The statute that governed that got changed. In where we, as a commission, were not in support of that change. And then there was a number of conflicts between what the statute was supposed to say versus the version that was actually passed versus what our directive said. And for a while, there was a real issue of limbo of who was actually what the priority point was. Because the statute said we were third, and our position was we wanted to be essentially last. We wanted to try to get all these other options before our staff was taking it over.
We don't want to be big brother.
Right. Exactly.
That should be.
Exactly.
Okay.
Exactly. The trouble was the statute had put us at third.
Got it.
And we got AG's opinion basically saying, as I recall, saying the commission can say, all right, even though the statute says we're here, we can take the position that we're down here and go through family members, friends, we tried to take the back seat to that.
Grandma, grandpa.
Right. That was a huge issue. The statute got changed over our objection, essentially.
And what we need to remember is that statute covers all adults. It's not just people in our care. It's the adult. So if I get hit on the head and I'm in the emergency room, they go through that pecking order if I can't give consent. So my husband's like number 1 on the hit parade, and then it goes all the way down like number 10. So I think that we have to remember that's one of the issues with this whole act. It's not just about our individuals. It is about all adults. Anybody over the age of 18. That's what this act covers. So we wanted to get some really good training on what the act is, and then how do we give guidance to our providers and ourselves when we have an individual who cannot give consent because they can't give informed consent.
Well, especially if there's an emergency situation, and you can't get number 1, number 2, you're having to look at who number 3 is, and that can become a problem. But we don't want to become big brother. I mean,
right now. Sorry.
I'm sorry. Excuse me.
I'm sorry. I was just going to say, right now we're number 7 on that list as I understand it. So we
got the statute changed again, but everything kind of got. It was a good year of chaos on that issue that we're trying to get straight.
Okay.
That as I recall was what.
All right, you helped me get through the legal muckety-muck. Thank you.
Yep.
All right.
Anyway, we're gonna fix it if it's the last thing we do.
Could I ask the chairman? Chairman, could I ask the chairman one?
Sure.
All right, we had passed to staff in committee, in subcommittee, your committee. We had passed to staff the restraint issue, modalities of constraint and all that, because there were a lot of technicals involved. Mary, maybe I directed you. When does that come up? Because of the Eddie Floyd concern that I think probably all of us had to make sure constraints do not include any kind of choking and that sort of thing. I wanted to make sure we had that.
We already sent out a memo saying that we do not do floor restraints. So, but there is nothing that's being taught that has that restraint in it. There's nothing. So if someone did that, just like I am sure there's nothing in the police manual that says you stand on someone's neck, but I'm just saying I can't the training is what the training is, and there's nothing in there that says this is what you do. So we just reiterated that with another memo, but we are looking at the we're looking at the directive.
Well, that's the point. I want there to be, when we get their proposal, and it's, I actually have it in the book, in this book that was sent, relative to the things in limbo, because we sent that back. The committee did not try to deal with the entirety. So we gave that to staff. We've done that before. Everything's fine because it comes back to committee. I just want to make sure that when it shows up, Mary, and here's my point. Okay, there's nothing that says do that, right? We want prohibitions from doing that. You cannot use choking mechanisms or anything that cuts breath off. A knee into the neck can kill you. A knee into the chest, not able to breathe, can kill you. It just takes longer. So the choking thing, the loss of air, we need to specifically prohibit so that however the training's done. I mean, they do this, you got police academy that they supposedly learn not to do that as soon as the person is subdued. I mean, as soon as you have to let up, we should not have any of the choking allowed, period, because it's so easy to kill somebody. So, and certainly, premeditated murder, almost like we saw with Eddie Floyd, y'all, is that's the kind of thing. Anger can get the best of a person. They get somebody down who's just screaming and going crazy, and it's real easy to go then, after you've got them subdued, that carries over to something else, and it turns into a catastrophe.
I do want to, we're operating out of time. I do want to understand that's going to be a forthcoming thing.
Yeah, that's definitely.
I do want to make sure that we're staying on the agenda today, because we're operating on sort of a tight time frame.
Thank you, I'm finished.
Yeah, thank you. Okay, so if I could draw Commissioner Malphras onto the tuberculosis policy.
Yeah, we'll work on David's concerns another day. The next item is.
Oh, can I just say something? We work on David's concerns every day. Because positional asphyxiation is not, that's already a prohibition. I mean, we watch our estates for that. So we work on that every day. We do.
Okay.
Okay.
Thank you.
Thank you.
Well, the policy we'll work on another day.
Yeah.
Right.
I forget we're being, sorry. Next item is that Susan's gonna take care of. It has to do with the tuberculosis, because that was something that we referred to staff.
Okay.
And I think that
We'll recognize Susan then on that.
Sure, so we're using our policy committee procedure, which is we bring directives that are due for review to policy committee, and they determine if it's appropriate to delegate to staff. This is one of those cases. So this directive in its revised version was posted for external review for 10 business days. We received no comments on it. We did substantially revise it just to make it easier to get to the section you needed. It was a long directive. Our medical director was key, as well as Rufus's staff, to look at that. And so we're presenting this version of the 60306 PD tuberculosis guidelines for screening for your approval today.
Robin, are you able to hear? Okay. Okay. Just want to make sure.
Yep.
Okay.
She's clear.
Coming from committee, then we'll treat that as a motion and a second. Any further discussion of the tuberculosis screening policy? Seeing none, all in favor, please indicate by saying aye.
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 Any opposed? Any abstentions? That policy passes. All right. I think that's it for the agenda from the committee. And again, guys, not to be sort of driving the train ahead, we've got somebody calling in at 12:15 that has, or at 12:15 to do part of our training. And so I'm trying to cover as much as we can before then. But if we get to 12:15 and we're still on the agenda, it's going to be my intent, because we have a very limited window for this one individual to do the training, to stop the agenda and get on the train. So I'm trying to drive this through as much as I can. So I apologize if I'm running over.
No, I agree. Go ahead.
We will keep our comments short.
Yeah. Okay. Next item on the agenda would be old business. Would recognize Rufus for updates on the bonus pay and the COVID-19 update.
Commissioner. I'll just give you a quick update on.
You can take your mask off up there so we can hear you.
Bonus pay. To date, we have awarded several bonuses to the tune of $263,000. That covers the period of April when we enacted this provision to the August 4th payroll cycle. Okay. Any questions from the commissioners? And I would like to express, and we pointed this out in one of the prior meetings, we are using existing personnel and operating dollars to cover these bonuses.
Is it working? Are we getting people who are willing to cover these shifts?
I tell you, it's helped, but, you know, we've had a great deal of attrition because of the crisis, you know, so it's, again, so the folks that are working are definitely appreciative.
Talking to the mic, please. Robin can't hear you.
Well, they can, but again, so folks are appreciative of what we're doing, you know, and there are other agencies that have employed the same measures. We had a meeting with PD providers last week as well, and a number of those agencies are employing the same provisions. Some are doing it in terms of doubling the salary. So again, this is a serious crisis, and whatever we can do to praise staff and provide incentives to keep them on the floor, we should do.
We have gotten volunteers to work specifically with the individuals who are sick because of this bonus. Although everybody else on campus wants it too. But, you know, it's just something we can't do. But so, and I told them, because we have town hall meetings now with all the campuses, and I basically said, you know, get on the list to volunteer to work with people that are sick if you want the bonus. So, because we do have a list of folks who are volunteering. So in that respect, working with sick individuals, it is working very well.
Any questions?
All right.
Thank you.
Thank you.
All right, next area, you have a handout actually. This is just a quick update on the impact of COVID on our system. To date, we've had a total of 1,109 individuals who test positive for COVID-19. Breakout between community providers and regional centers, consumers and staff is as follows. For community residential settings, we've had a total of 253 served test positive for COVID-19. This fluid is, in fact, this morning I was made aware of a positive case at Whitten Center. For staff in our system, members of our workforce, among our community providers, we have a total of 448 staff to test positive for COVID-19 and 245 members of our regional center workforce to test positive. This brings a total to 693 staff that are positive. A number that I don't take any pleasure in reading is total fatalities. In our system, we've had a total of 36 individuals who have tested positive for COVID-19 to die. And so this brings the importance of eliminating this virus to the forefront, and our hearts and prayers go out to these families. For individuals in our care, we've had 12 community individuals served in community residential settings to pass away who tested positive for COVID-19. And in our regional centers, we've also had 12 individuals pass away. Our staff members, or members of our workforce, and among our community residential providers, we've had a total of 8 staff to pass away. And in our regional centers, we've had 4 members of our workforce that we've lost. And again, these are numbers, but they're names tied to each one of these numbers, and our hearts and prayers go out to the families and the colleagues that work alongside these folks. And we're eternally grateful for their dedication to the mission. There are a couple of slides that really are more positive that you can look at your leisure, but basically the short, we've reached our apex in terms of number of positive cases. Really around the period of July, we're starting to see a downtick in the number of cases, although we continue to test, and we've actually had individuals that we tested recently within a 90-day period to continue to test positive for COVID-19. And that's important to note because it really skews the numbers and adds another complexity to our operations, but we still have to enact our isolation and quarantine guidelines, which will also affect bonus payout. This morning, I was made aware of a kind of an anonymous letter that went to commissioners, from the staff that are tired at Whitten Center. I agree with the staff, they are tired. There's some things in there that we can elaborate on, but again, we created forums within the past couple of weeks to hear directly from the workforce. We have weekly town hall meetings that are open to all staff, when they're available. State Director Poole, Pat, myself, have visited Witten Center multiple times, on the weekends. So when the comment that we're in the administration building, that was actually on a Sunday. But, and then July 4th, I think we were in there just because, it wasn't a happy time to be there. But we've actually gone into buildings, myself, Mary, that are under quarantine. So we're not asking people to do anything that we're not willing to do. And so we're going to continue to provide support and do whatever we can to create an air of transparency. But we have made it very, very clear that we are open to input, whatever the subject, to keep our workforce and those in our care setting. So I want you guys to be aware of that. And again, we can elaborate in different settings, different meetings, but we will continue to be on the ground there to hear folks. And later today, I'm having a meeting with facility administrators to talk about workforce realignment, organizational structure enhancement, and things that we can do to live with COVID, because it's not going anywhere anytime soon. And so we will make every alteration to, again, keep operations optimal and keep our workforce safe and those in our care safe. Any questions? All right, thank you.
Thank you, appreciate it, sir. Okay, moving on to new business, we have the federal grant. Is there six of them federal grants?
Yes,
We're on, this will be,
are there tabs?
I don't know if there's a separate, I don't know if there's a separate tab for this, but it's item number 12A.
Yeah, I don't think there was really anything to hand out.
Okay.
I'm gonna try and go through this really, really quick and try and honor your time, and hopefully you actually get to your 12:15 without having to cut the agenda. Directive 10301DD is the federal grant application award policy that Robin mentioned earlier that we are in current process of reviewing in the Finance Committee. Currently, it requires that this commission approve federal award grants prior to submission as well as prior to receipt of the funds from the grant. Some of these grants, I think, may have gone through without your permission prior submission, prior to me even getting here, and then one since I've been here. So I just want to go through these real quick. First of all, many, many years ago, the DDSN applied on behalf of providers to get generators funded for FEMA, and we were successful in getting many, many generators and fully funded those. We provide the state match for those, and so there are two existing FEMA generator grants that we're in the process of implementing. One is $426,000 in federal awards for Jasper, Charleston, and Sumter generators. And then the final piece to this project, because it's been in like 5 or 6 phases, is $126,000 in federal funds for Darlington. So that's two of the grants. We also, the HVAC system that you guys just approved the other day, last commission meeting, I think it was, or maybe 2 ago. Andrew Theron realized on the very last day, actually, that we were eligible for a $10,000 grant. So he went ahead and filled out the paperwork and submitted it. So there was no time in there to come to you guys, or we'd have missed out on that opportunity. We still don't know if we've been awarded that $10,000 or not. The CARES Act Provider Relief Fund, we're in the process of trying to submit right now for those funds. That is the funds available through the state that we mentioned in Finance Committee. $270 million available to providers. We do believe our request will be well under $1 million as that couples up with another grant called the FEMA Public Assistance Grant. And between those two, they split all these COVID-related expenses. So we are in the process of submitting these, and I have validated that if we find that we have submitted these funds and really weren't eligible because we're under a tight gun to submit these, we don't want to have double dipped ourselves, and so there are return provisions without penalty. So if we have applied for these, get them in term we shouldn't have gotten them, we can return them without getting in trouble. And then the final one is the Mobility for All grant that we just talked about, $326,000 in federal awards. DDSN is a subrecipient of that grant. They needed a state agency or local entity like us to manage that grant. Basically, we've agreed to pay the bills and do the accounting for it, and we've committed $22,500 in in-kind contributions. That's the value of our labor. So these are the 6 federal awards, and we need your approval. We have not submitted the CARES Act or the FEMA PA yet. The other 4 have been submitted, and we haven't received those funds yet.
Any questions regarding the 6 proposed grants?
Move to approve.
Do we have a second?
Second.
Okay. All in favor, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none, those 6 grants are approved.
I think the first was by Commissioner Thomas and the second was
Yes, by Commissioner Miller, sorry.
Commissioner Miller. Okay. Financial update. In your packet under tab 10, you'll find June's final year-end report, as I told you I'd provide. I'm not going to spend time on that unless you want me to. I want to focus on the July report. Things you will note in there are that if you look under the continuing resolution appropriation column, we have rolled our budget and we have no spending plan yet. Y'all will be taking that up at the September meeting, which is our internal budget, whereas that appropriation is the funds that we're authorized for. We only get less than $300 million actually from the state, so our ability to generate Medicaid match is the only way we can generate $800 million in actual budget. So we have to drill that down to our spending plan. If you look under the year-to-date actual expenses, we're actually over budget through July, which is very odd. So you really have to dig into what's caused that. If you look at the box at the bottom right, we are virtually cash basis here, which again is something I continue to say, and it drives me nuts, but that is how the state does things. For us to get away from that, we're going to have to do all of our accounting in Excel, basically. But we've had a 3rd payroll hit July. The employer contributions related to that, as well as workers' comp's quarterly contribution, hit July, and then we pay providers 3 checks in July, and so that was $16.5 million. So $21 million basically of that 68 is timing issues. So we really only had $47 million in expenditures, putting us at 5.8% budget expended for July versus a target of 8.33. Any questions on that? I know I went through that really fast, but I'm trying to.
glad you can figure this out.
Above budget.
Wow.
We're below budget.
Below budget by 3.2%.
Yeah, right. We're doing well again so far this year.
Any questions regarding the financial update? Would entertain a motion to approve the update as presented.
Second.
Same, just for the record, same movement and second on that. All in favor, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none, that is approved. Next item, Chris, the provider contracts update.
All right, tab 11. Commissioner Thomas had asked and the commission had agreed that they'd like to see all of our amendments that we do on a quarterly basis, even if they don't go over $200,000. Item D that we're going to talk about in a minute are those contracts over $200,000 that will need your specific approval. But this recap is our final amendment for fiscal year 2020 as we true up all the beds and the different population changes for the 4th quarter. It totaled a net change of $285,000. There's a lot of pluses and minuses in here. So this is, I don't know that y'all actually approved this, Commissioner Liddell.
It's been an informational.
I think it's informational. So if there's no questions, I'm done with that particular topic.
Any questions regarding the provider contract?
This is the over or the under 200?
This is everything.
Under, yeah, this is the,
Yeah.
well, the primary focus on this is yeah, it's the under. The stuff that doesn't require us to approve it, but it's just over time it builds up.
It's a quarter's worth there.
Yeah.
Okay, thank you.
And so you can read it at your leisure. If you have a particular question, you can just ask Chris about that question.
I almost feel like I need a mini course.
Sure, we'll be glad to do
I
that.
also feel like if I call you, the whole thing may fall down. So I don't want to bother you.
It's
No,
not a
we're-
pretty lengthy list.
We can meet with you at any time. All right.
So the next item is the provider contract increases that are necessary for approval.
Is that number 12?
That would be, yes.
Yes, tab 12. So what you'll notice as a commissioner is as we get closer to the fiscal year end, contract amendments get smaller and smaller because you are amending for a shorter period of time. We add funds back if we have a bed vacancy in May when we run our original contracts, and let's say somebody moves in June or July, we have to get them their money. And so this is adding slots funded for either filling beds or new waiver slots. And these are the 3 contracts that exceed $200,000. Everything else was below $200,000 per agency.
Any questions regarding the amendments that were in excess of $200,000?
You also note these are our very large providers. All 3 of these are 3 of our largest agencies that we contract with.
So for instance, this is a real quick question. So for instance, in the upstate, Thrive, for instance, all right, if they're asking for additional funds, when they're asking for something additional like that, upon what basis we, Mary, how's that determined? Yeah, that's fine.
Yeah, they don't really ask for it, so they've got funded beds. I have 4 beds in this facility, and it was empty when the year ended. But now it's filled. We got to pay them for it because it's a funded bed.
It comes with automatic.
Yes.
I got it.
Unless we pull a bed. You know, some programs we actually take the bed if it's vacant. But in this case, the bed's just sitting there. They need to fill it. And they work with Rufus's team to identify who to move in.
Right. When you talk about the Band B and the CS, those 2 lines, those are waiver slots awarded to the next people in line. They just happen to fall into that county. It could have been any county.
Yeah.
But so Greenville got 4, and then 4 of the Band Bs, which are the IDRD waivers. And then they also got 5.
I was going to ask about the Band B. Okay.
Yeah, that's just a waiver. It's part of the waiver of IDRD.
Okay.
It's the community people.
Oh, okay.
No residential.
And we have a cap at the state level for those funded slots, and there's an internal audit report I think y'all got where Kevin looked into.
So these are not out of control numbers. They're within the what we
normal attrition and
respectively.
Folks coming and going. Like, you don't see the negatives a lot of times. Deborah Leopard, who does all this for us, thank you very much, Deborah, if you're listening, says they never see the negative 200,000s and the negative, you know what I'm saying?
Yeah, rather than
when we take money, y'all never see it.
There's amendments that reduce and amendments that increase. And most of what we see on so like this is because somebody decided, either somebody passed away, and that would be one of the negatives, and the new person comes in and says, but I'm going to be served instead of by Max Abilities, I'm going to be served by Thrive. So that money that goes and amends Thrive's contract.
Thank you, Chairman, and Chris and Mary.
Yes, sir.
But if you need more information.
Thank you very much. Thank you.
Any other questions? Would entertain a motion then to approve the amendments as proposed. Have the primary motion from Commissioner Miller, second from Rollinson. All in favor, please indicate by saying aye.
Aye.
Any opposed? Any abstentions? Hearing none, those are approved. Thank you, Chris.
I am going to be super duper fast. I just want to give you an update. I'm going to get rid of all the other stuff. I'm going to talk about the Appendix K. Just want to give you an update as to where the new K is. It was sent in a few weeks ago, and then CMS sent the entire thing back for a rewrite. They felt that the language was too provider-centric, and they wanted to be more person-centered. Even though it was about retainer payments, it's about retainer payments for services for people. And they wanted to make sure the language had said that. So basically, they rewrote it. It was sent in last week. He said on Friday. He's waiting for it at any time, and we're working on forms for the providers that might get these retainer payments to make sure they attest to those actual losses that are based on actual billing. And so we can operationalize it as soon as we get the go-ahead to do this.
Quick question, Chairman, may I ask for a quick question? CMS is in Atlanta. That's our Atlanta group that kind of oversees. Is that who that is?
Yeah, the regional area.
The regional, all right. As I understand, CMS is kind of the big dog in the sense of overseeing.
Yeah, they approve all these. Yeah.
Okay, and if they didn't like what they saw, they could, the result would be what?
If they didn't like, usually it's a conversation. They come back with questions,
Okay.
we kind of rewrite it to where they feel okay with it. They didn't have a problem with our methodology, they just had a problem with the language, and that's been worked out, according to Director Baker. I spoke to him probably about 10 minutes before I came in here.
Okay, do they also look at finances and things like that, whether or not we're doing this right relative to federal guidelines?
Oh, they look at our methodology. How did we come up with the dollar amounts? How are we doing this? They want to make sure it fits into guidelines. Yes, sir, they do look at that.
Yeah, they can pull us for an audit if they
Yeah.
want to do it.
Okay.
Yes, they
Yeah,
can.
They actually sent us, we just went through what's called a perm audit. They selected, I don't know, 60 or 70 individuals, and they wanted all the backup to support all the services we had built them. Coming out of that, they can
Kind
make
of a
us.
sample?
Yeah, they do
Yes.
that.
So yes, they do that.
All right, so if you get in trouble with CMS, you're in a pickle.
Yeah, pretty much. They're the feds, they're the match, so they're holding the bigger piece of the pie.
Yeah,
Yeah,
okay, that's all.
but they do audits.
I got a lot of questions, but it would be some subcommittee, something or other, but I don't want to take.
Or if you want to do a CMS discussion, we can do that.
Yeah, that's what I want.
Okay.
I would kind of like that. Yeah, but later.
All right,
I'm stunned that you have questions.
Oh.
That's just so unlike you.
never happened. There's so many rabbit holes you can, on every single thing. But I've got Ms. Foster dialing in at 12:15.
Right.
So if you want to just get to the,
Anything else you need?
no, I think that's the
All right.
most important thing, because that's what everybody wants to know, is that Kay's coming.
Okay, so, I'm not aware of any need for executive session. Is anybody else aware of any items that need to be taken up in executive session? Hearing none, the next regular meeting is set for September 17th. We will decide as we get a little bit closer, based on everything, whether that's going to be primarily a Zoom one or an in-person one. Appreciate everybody's cooperation on this one so we can get the training done. And for purposes of the substantive report, we will stand adjourned. And then we will move into the training sessions that we are scheduled. Thank you very much.
Robin, I'm